निर्विघ्नं कुरु मे देवा सर्वकार्येषु सर्वदा जयन्ती मङ्गलाकाली भद्रकाली कपालिनी दुर्गा क्षमा शिवा धात्री स्वाहा स्वधा नमोऽस्तुते वसुदेवसुतं देवं कंसचाणूरमर्दनं देवकी परमानन्दं कृष्णं वन्दे जगद्गुरुं नागेन्द्रहाराय त्रिलोचनाय भस्मङ्गरागाय महेश्वराय नित्याय शुद्धाय दिगम्बरागाय तस्मै नकाराय नमः शिवाय। ॐ नमः शिवाय। रामाय रामभद्राय रामचन्द्रमभेदसे रघुनाथाय नाथाय सीताये पतये नमः। ॐ मनोजवं मारुततुल्यवेगं जितेन्द्रियं बुद्धिमतां वरिष्ठं वातात्मजं वानरयूतमूकं श्रीरामदूतं शिरसि नमामि। ॐ नमो भगवते वासुदेवाय। बोलिए ॐ नमो भगवते वासुदेवाय। ॐ नमो भगवते वासुदेवाय। ओम श्री कृष्णाय गोविंदाय नमो नमः। बैठिए, let's resume our seats. And as we engage in opening kirtan, let us join together, let us clap our hands, let us sing lustily as we glorify Bhagwan.
जय जय गणपति, जय गणपति, जय गणेश, जय गणपति, जय 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 गणपति, जय गणपति, जय गणेश, जय गणपति, जय जय गणपति विघ्न विनाशनहारी, गणपति विघ्न विनाशनहारी, गणपति विघ्न विनाशनहारी। गणपति जय जय।
Prem se bole Shri Ganesh Bhagwan ki jai. And how beautiful it is to commence our satsang glorifying Ganesh Bhagwan. We would all recollect very fondly last Sunday in the culmination of that wonderful festival of Ganesh Utsav, where we all joined together in that Visarjan ceremony. Most of us there down at the seaside as we concluded our love and our devotion, and then moving straight away this week into this wonderful period of Pitri Paksh. And we'll be hearing a little bit more later on in our service. We continue in glorifying Bhagwan this morning. Let us once more join together as we engage in Kirtan, glorifying Bhagwan.
जय कृष्ण हरे श्री कृष्ण हरे, दुखियों के दुख दूर करे। जय 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 कृष्ण हरे, जय कृष्ण हरे श्री कृष्ण हरे, दुखियों के दुख दूर करे। जय 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 कृष्ण हरे। जब चार तरफ अंधियारा हो, आशा का दूर किनारा हो। जब चार तरफ अंधियारा हो, आशा का दूर किनारा हो। और कोई न केवल हारा हो, और कोई न केवल हारा हो। फिर तू ही मेरा पार करे। जय 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 कृष्ण हरे, जय कृष्ण हरे श्री कृष्ण हरे, दुखियों के दुख दूर करे। जय 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 कृष्ण हरे। तू चाहे तो सब कुछ कर दे, विष को भी अमृत कर दे। तू चाहे तो सब कुछ कर दे, विष को भी अमृत कर दे। पूर्ण कर दे सबकी आशा, पूर्ण कर दे सबकी आशा। जो भी तेरा ध्यान करे, जो भी तेरा ध्यान करे। जय 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 कृष्ण हरे, जय कृष्ण हरे श्री कृष्ण हरे, दुखियों के दुख दूर करे। जय 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 कृष्ण हरे, जय कृष्ण हरे श्री कृष्ण हरे, दुखियों के दुख दूर करे। जय 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 कृष्ण हरे, जय 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 कृष्ण हरे, जय 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 कृष्ण हरे।
Prem se bole Bindravan Bihari Lal ki jai. Before we enter into a few moments of meditation, as I mentioned today, and as I'm sure we're all aware, we're in that period that is set aside in our Panchang known as Pitri Paksh, or that fortnight that is dedicated to the worship of Vishnu Bhagwan on behalf of our ancestors. So again, just dispel any misnomer. It is not that we are praying to the dead, or that we are worshipping the dead, or that there's anything untoward that walks around the place after 6 p.m. in the night, or any such rumor or misinformation. It is a period that has been designated specifically for us to direct our mind, our thoughts, our attention, our puja towards Bhagwan for and on behalf of our ancestors. And it is a wonderful opportunity for all of us without exception. In that vein, next week Sunday, as has been done customarily over the last several years, Pandit Devendra will be leading those persons who are interested in engaging in that act of worship and that act of puja through Tarpan next Sunday morning from 8 a.m. And that therefore means that those persons who are interested in offering Tarpan, as I know several of you have been in the past years, that you try and get here for about 5 to 8, not 8:10, not 8:15, not 8:05, but before 8 a.m. so that we can start. I will advise you that there are a couple things that you should bring with you. If you can, bring 2 receptacles, and please remember how you are doing the offering of Tarpan so that it's practical, because it's a congregational type of activity. I would suggest a bucket to do the offering in, and I would suggest a big bowl that your hands, both of your palms, could fit in to take out the Tilanjali that will be offered as the 2 containers. So when you're offering continuously, a bucket will be able to hold all of the liquid that you are offering. So a small bucket, as well as a large enough basin or bowl that you can have your Tilanjali in. We will of course provide the water here at the Mandir. You can bring with you kush grass, and that kush grass should be planted in something like a little receptacle so that it remains upright and it isn't all over the place. If you don't have kush grass, I'm sure Vishnu, you can help us out with that. Some kush grass may be provided, but if you are able to secure the kush grass, then bring that with you. A little bit of milk for some of the initial offerings. Some white rice, black till, and tulsi leaves would be what you need, and some flowers. So just repeating the 2 receptacles in the manner that I've mentioned, right? Your kush grass planted in a little container, that's so that it remains upright. Some black till, some white rice, tulsi leaves, and a little bit of milk that you can bring with you. We will then be guiding you through the process on Sunday morning from 8 to finish by about 8:30. And then we will commence our regular service. Please share this information. It will also be circulated on our social media so that you will be reminded. And please be here for just before 8 a.m. so that we could start promptly. Let us sit up right now for a few moments. I invite us to gaze at that Murti of Krishna Bhagwan. Look at him as he stands resplendently. Gaze at his yellow dhoti, that peacock that adorns his forehead, and that basuri which he holds in his hand with that beautiful divine sound. Fix your gaze on that form of Bhagwan. Now close your eyes, retaining that form. Pray to Prabhu during this most auspicious time. Let our thoughts also include those loved ones who are no longer physically here with us, but whose life and legacy remains ever part of each and every one of us. And with all sincerity, with all positive thoughts, we pray to Bhagwan for the benefit of the Atma of those persons. Wherever that Atma may be, whatever form it may now hold, may Bhagwan shower his richest and choicest blessings upon each and every one. May that Atma be at peace. May that Atma enjoy all of the punya of the acquired karma. May that Atma enjoy the benefits of our own offerings and our own prayer. We continue to focus our mind He Govinda, He Gopala. We pray to you with that Shraddha, with that faith that our prayers would be heard and that the blessings would fall in the appropriate way, on the appropriate form. Om Namo Bhagavate Vasudevaya. Om Namo Bhagavate Vasudevaya. Bole. Om Namo Bhagavate Vasudevaya. 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 Visualize Krishna Bhagwan as we sing together. Devaya. Om Namo Bhagavate Vasudevaya. 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 In this way, during this period of Pitripaksh, we send those positive vibrations, those thoughts, the offerings of Tilanjali, the offerings of Puja, the offerings of Pindadan that may be made. Whatever offerings we make, Annadan that we may make during this time, for the benefit of all of our ancestors, wherever they may be, and in whatever form they may now inhabit and occupy. And we do so through the medium of prayer to Bhagwan. Om Namo Bhagavate Vasudevaya. Shri Krishnaya Govindaya Namo Namaha. Prem se bole Bindraban Bihari Lal ki jai. This morning, as we continue on, again, it is important for us to not only remember of our parents who are no longer with us, but also to think of ourselves and many parts of our health that we sometimes ignore. And we have at the Mandir since last year been carrying on a series of lectures dedicated towards each and every one of us and our health. And so this morning we have another such installment, and I'd want to invite to the podium to introduce our speaker, Dr. Mitra Maharaj, and he will do the introduction. And I ask that you give the speaker who will be coming on your undivided attention so that we can indeed learn and be enlightened. Are the teachers of the children's class here? Yes. So as Mitra makes his way to the podium, we'll ask the children to please make your way downstairs with Auntie Yamuna and Auntie Shivma, both of whom are here. Today marks the commencement of our new session, our new academic year for the Balvihar program. And we are therefore inviting all of the children, don't be shy, even those of you who are with us for the first time. This is the first class. There's lots of exciting and wonderful things to do. And you will enjoy it tremendously, I assure you. We have an upcoming Diwali program, and we will be preparing the children for items in that program. I hand over now to Dr. Mitra Maharaj.
My job is very simple. Wait. Testing 1, 2. Right, sit down everybody.
Sitaram.
So my job is very simple this morning, just to introduce our speaker, who is no stranger to this temple, who has grew up in these very halls, these very benches, on this very ground, singing in our bhajan group. I talk about none other than Dr. Avasa Tiwari, who has been a medical doctor working in the field of ophthalmology for a number of years right here at the San Fernando General Hospital. She, after graduating with a medical degree from UWI St. Augustine, she went on to do a diploma in what we refer to as primary care ophthalmology, which means that she counsels patients on eye health and care before they reach a certain critical age where they need to be warded at hospital to take care of that eye illness. So you might see her here hustling and run around with the little 2 boys that she has here, but she grew up right here singing in our very bhajan group, and she was a very active member of the youth group. So without further ado, I would like to invite Dr. Avasa Tiwari to come to the podium.
While Dr. Tiwari makes her way, before she gets there, let's just adjust the microphone system so that we can have
1, 2.
so that we can have an unimpeded flow. And while that is being resolved, just a few things for us to note. We want to be reminded of upcoming events. Navaratri will start, as we know, in October. We're commencing in October, and we will be giving you the dates and so on. I think we are getting ready with regard to the sound system. So our first installment, as we commence the Navaratri period, will be the 3rd of October. That's Thursday the 3rd, and on that very night, we will be joining with members of the Gujarati community right here at the Mandir as we observe our worship to the Divine Mother through the form of Garba, that medium of dance. So the very first night, we're inviting all of you to join with us here at the Mandir as we commence our Navaratri celebrations, and indeed to join with us also as we join with the Gujarati community to celebrate Garba on that night. That's the 3rd of October, Thursday the 3rd. And then we continue on straight until the 11th, when we will end, and that marks also the beginning of the Ram Navami that is being hosted by the Knox Street Sports and Cultural Organization. So you will be hearing more in our announcements later on. Without further ado, our technical issues having been resolved, I hand over now to Dr. Tiwari. Avasa, please. Thank you very much. Please welcome her with a round of applause.
Sitaram, everyone. I am not as comfortable in front of a microphone as my mother is, so excuse me. So I'm just here to talk about a few common eye conditions that you all may hear people talking about, more the elderly people might be concerned about, and can be a little bit confused about as well. So, change the slide. How do the eyes work? So that's basically a picture of the anatomy of the eye. The part that you all might be more concerned about is the front of the eye, which is that clear area that you would see. Beyond that, you would have the lens, which will eventually turn into a cataract. The white area is called the sclera. Sorry, that's the front of the eye still. So at the front of the eye, you'll have the clear area, which is the cornea. Then the brown area is called the iris. The black dots is called the pupil. The white area has some thin layers ahead of it called the conjunctiva, then the sclera. Then when we talk about retinopathy, it's actually the back of the eye, which is this section here, and the retina has the photoreceptors that will take all the information to the nerve. So the light falls to the front, it's refracted or bended by each area, falls to the back, and then goes to the brain through the nerve, the optic nerve, right? Hopefully that. So you could go on to the chalazion. A common occurrence that a lot of people might find happening is this little bump on the front of the eye. It's called a chalazion. There are different names as well, called hordeolum, sty. It's basically because of a defect of the meibomian gland in the eyes. It tends to be related highly with dry eyes and people who we consider to be atopic, which is people who tend to have a lot of allergies. So it could also be related to blepharitis, which is also related to meibomian gland disease, rosacea, seborrheic dermatitis, and patients with pregnancy and diabetes as well. It's basically a painless lump. It's basically a painless lump, usually single, but a lot of times it can be multiple, and very recurrent and can rupture through the skin, right? Now, this lump also, you could go to the next slide, Material, I'll show right, so this is a picture basically showing this terrible cycle of inflammation with dry eyes, a chalazion, and what we call a blepharitis. A blepharitis is inflammation of the lids. So your eyelashes are there to protect the eyes from dirt, debris, dust going into the eye. Without proper hygiene of the eyelashes, which I think we forget people are not really aware of how much we are supposed to actually clean our eyelashes. That debris could actually start to block your meibomian glands. And the whole cycle of how your tear film and your tear ducts are supposed to work can actually work together with the eyelashes to cause what we call a blepharitis, where that debris is not washed out properly, and the blockage of the glands cause all just infection and inflammation to keep collecting there. So you have dry eyes, the blocked glands cause the chalazion, and the blepharitis just keeps repeating the cycle. The blepharitis is the collection of the dirt and debris causing inflammation on the lids, right? So this is something we deal with a lot, with a lot of patients. One of the main ways to help to avoid it is by, on a daily basis, cleaning your eyelids with baby shampoo and water. So first you can take a warm compress, which is a clean rag with warm water, put it on the eyes for 5 to 10 minutes, and while the ducts are still opened, you use some baby shampoo and water and take a Q-tip and clean the lash line. That helps remove the sebum and dirt collected there, blocking the glands, right? So that is one of the ways that could actually assist with dry eyes, assist with these chalazions. If you actually do have a chalazion, that growth on the eye, or bump on the eye, it's not really a growth, you can do that process more. We say water as hot as you can tolerate. You up that game to 4 to 6 times a day, and you could additionally use some antibiotics with it. At that point, you might have to see a doctor for the antibiotics. But if it's now starting, you could just use the warm compresses and lid hygiene. So the next one is conjunctivitis. So there are a lot of different forms of conjunctivitis, As I said, the conjunctiva is a thin membrane that becomes inflamed or swollen due to varying reasons. It could be because of allergies, it could be because of viruses, it could be bacteria, or just simple irritants, right? Viruses, for example, is the one that when you hear people say they have red eye and it's highly contagious and everybody has it, you find they will have, their eye will be red, it will be itchy, it will be watering like crazy. Even for us, sometimes when patients come with these red eyes, it's hard to tell in the immediate days whether it's viral or bacterial, unless they have a particular irritant that we know affected them or allergy that's affected them. So sometimes when you see people with these red eyes and it's very, very runny, you should still just avoid or wash hands properly around them. But the treatment for these will be varying depending on what's causing it. So the next one is the next slide is, this is a subconjunctival hemorrhage. Just a short note on this, some people might just see that red blotch in their eye, or in the next slide, a big red, and the entire eye is red, and they would think this is the worst thing that could possibly happen. Their eye, they don't know what's going on with their eye. This could be as simple cause as trauma, right? Sometimes in the night, you don't know what you're doing with your hands hit your eye because you was whacking away a fly, or people with high blood pressure, it could just pop a vessel in the eye, as simple as that, and the eye could get this way. It's painless. It tends to be painless. You see this red spot in the eye, but it's completely painless. You don't know how it happened. In most cases, this is what I call the eye's version of a blue-black spot. It's blood collecting there, but it's contained in the conjunctival sac, so it's gonna wear away with time. How you know it's this versus some sort of infection? In most cases, infection would come along with pain, itchiness, pain, itchiness, and the watering of the eye. Predisposing factors to this condition would be older age, as I said, trauma, people who are on aspirin or any sort of anticoagulants, or bleeding abnormalities. Next one is a pterygium. A pterygium. So I think a lot of people confuse this when they hear they have a growth in the eye. Sometimes they say, well, they went and cut the cataract already, but it's not the cataract. It's called a pterygium. It's a fleshy growth, fibrovascular growth, that actually goes from the white part of the eye, and sometimes it goes over onto the clear surface of the eye. It's not a cancer. It's just a fibrovascular growth, and it's wing-shaped typically. It tends to happen when you live or have dry eyes or live in an area that tends to be dusty or windy or sandy, and you have long-term exposure to ultraviolet rays. Ways to prevent this is one of them is wearing shades, but what you really do with this is use lubricating eye drops like Refresh, Sustain, any one of those. I can't choose a brand, but because each brand of those eye drops are particular to you. Some people like one more brand than the other, and that's just up to you, really. But this pterygium, it's at the front of the eye. It's not inside the eye. It's just at the front of the eye. Some people will say they went for a scraping. This is what they remove, but always know that this growth could always come back even after you remove the scraping. The next one is refractive errors. This is simply, in most cases, patients who need glasses, right? You have a refractive error. There are different types of refractive errors. Myopia, hyperopia are the most common, meaning that you're short-sighted or far-sighted. And then some people say they have stigmatism. It's astigmatism with the irregularly shaped surface of the cornea. Most likely you're born that way in most cases. And presbyopia is as you get older, right? right now we have a growing problem with myopia, which is short-sightedness, right? And there's a growing concern for the increase of myopia in children, with myopia becoming twice as common as in the 1960s, and it usually occurs between 6 to 13 years, and an earlier onset is associated, let's move on from that. The high myopia increases the risk of vision-threatening eye conditions. So being highly myopic, meaning that if you are short-sighted, but this is extremely short-sighted, not people with just a small refractive error, they tend to have a higher risk of needing cataract surgery, they could have retinal detachments, and or develop glaucoma early. So this is what I wanted to talk about, tips for slowing myopia. They think myopia is highly related to the use of the length of screen time. So things to slow it is spend at least 2 hours a day outside, spend less time on screens, keep your distance from screens at least 25 inches or 2 feet away, and take breaks. So they have this 20-20-20 rule where you take, after 20 minutes of using screen time, you look in the distance at 20 feet for at least 20 seconds. That's the rule. And after 2 hours, I think you should take, ideally, a 15-minute break. This would help you with not only myopia or needing glasses, but also dry eyes. Dry eyes because these studies show that you blink less while you're using screens. Cataracts. Cataracts, what you must know, is not necessarily something that is in the family. Cataracts are clouding of the naturally clear lens inside the eye. It's a natural progression as you get older. At some point, you are going to have a cataract in most cases. Yes, it's hereditary sometimes in terms of how early you may get it, but you are going to have a cataract at some point in your life, especially if you're over the age of 55 to 60. It just may be small versus large. There are risks in terms of how bad of when you develop a cataract, such as if you have trauma, it can bring on an earlier cataract. If you are diabetic, it can bring on earlier cataracts. But you are going to have a cataract even without those. It's progressive and gradual and very common. And it's also correctable with minimally invasive outpatient surgery. So as I was mentioning before, the risks of cataract increases as you get older, and also smoking and alcohol use and prolonged exposure to sunlight are other risk factors for cataract. Once your cataract, some people always ask about cataract. Doc, I have a cataract in my eye, I had to take it out. No, you don't have to take out a cataract as soon as it's in your eye. I mean, the layman term is, it's a ripe yet. It's a ripe yet, right? So your cataract can be there, but some people see very, very well with their cataract in their eyes. For some people, it may affect them differently, and they could have the smallest cataract, and it's affecting them greatly, because there are different types of cataract as well. Some can stay in your eyes for many, many years and not affect you, but then there are others that can actually cause glare to affect you very badly, and you need to take it out. So it's subjective, and it's a subjective thing by patients where we assess them properly to know whether or not how it's affecting your functionality is when we decide to take it out. Because cataracts, I'll just go a little more into it because I know this is a big concern. Cataracts, when you do cataract surgery, there will always be risks. Whoever is doing it, wherever you are doing it, there will always be risks. So that's why you will find that we will tend to wait until it's quote-unquote ripe for us to take it out, or affecting your functionality, and not just remove it just because you have a cataract. A lot of times cataract can be corrected by changing your glasses. Not corrected as in moved, but your vision, you can help your vision by at least wearing glasses until it's ready to be cut. Once you remove your cataract, it's not going to come back. Cataract does not come back. It does not grow back in your eye. So ways to prevent cataract is wearing unshades, UV protection, smoking cessation, good nutrition, and your eye exam every 2 years just to let you know when it's ready to cut. Another popular topic for us is diabetic eye disease. There are different types of diabetic eye disease: diabetic retinopathy, diabetic macular edema, and well, you can develop cataract and earlier onset of glaucoma when you have diabetes. Who is at risk for diabetic retinopathy? Well, patients who are diabetic and very poorly controlled in most cases. The longer a person has diabetes and the less controlled their blood sugar is, the more likely that person is to develop diabetic eye disease. And also women who have diabetes in pregnancy, in most cases when they were already diabetic and became pregnant, they can also have a rapid onset or worsening of their diabetic retinopathy. Symptoms of diabetic retinopathy: in most cases, there are no symptoms. Sometimes it goes very unnoticed until you actually have, until it affects your central vision, you may not notice it. So you have bleeding from abnormal retinal blood vessels that can cause the appearance of floating spots. People have these floaters. Their spots sometimes clear on its own, but without prompt treatment, bleeding often recurs, increasing the risk of permanent vision loss. So about those floaters, if you're not diabetic, in most cases, it's not really something to worry about with urgency, unless you're also a highly myopic person. Those floaters are very normal to see because they're inside the jelly of the eye. It breaks down as you get older. Another aging process, the breaking down of the jelly in the eye causes those shadows for you to see when you're looking around. I have a good bit. So it's more when you see a shower of those floaters to be more concerned, but it's fair to check it out at any point in time, really. Beyond the next stage from diabetic retinopathy has various stages, which I really don't have to go into detail about with you all, but one of the stages, more to the end, is what you call diabetic macular edema, that's the point where you will realize that you're not seeing well because it's affecting the focus points of vision. Some diabetic studies have shown that controlling diabetes slows the onset and worsening of diabetic retinopathy. So that's what I had mentioned that before, where one of the key things is controlling your diabetes. Because diabetic retinopathy often lacks early symptoms, comprehensive dilated exams at least once a year are suggested for patients with diabetes. People with diabetic retinopathy may need eye exams more frequently. And people with more severe retinopathy would require more frequent monitoring. So some patients might wonder, well, doc, I have diabetes. Why my appointment is 1 year from now? Because you actually have no changes. But patients who are being seen every 3 months or every 4 months, they probably have changes, and we need to do laser, we need to do injections in the eyes. So I always tell patients, don't compare yourself to other people when they are asking questions about their eyes. Your eyes are very different, and your concerns are very, very different from each other. So treatment options for diabetes, diabetic retinopathy, as simple as controlling your sugar, or some patients reach the stage where they may need injections in the eyes or laser for the eyes. And some people reach the stage of also requiring surgery for the eyes. Another topic in our country is glaucoma. Glaucoma is a group of diseases characterized by progressive optic nerve damage, with corresponding visual loss, in which intraocular pressure is a key modifiable risk factor. So risk factors of glaucoma are high eye pressures, African or Asian heritage, being over 60 years old, actually 40 years old for African descent, being nearsighted, long-term use of steroids, family history, and diabetes. Glaucoma can cause irreversible blindness, so because it has no cure. Cataracts can cause what you call reversible blindness, because in most cases, once you remove your cataract, you can see better afterwards, once you had a successful surgery. Glaucoma, however, can slowly damage the nerve in your eye, and once that nerve is damaged, there's no recovering it. So at first, open-angle glaucoma has no symptoms. It causes no pain. You have no idea it's happening. The vision stays normal. Glaucoma can develop in one or both of the eyes. Without treatment, people with glaucoma will slowly lose their peripheral vision. That's how glaucoma damages the nerve in the eye. So you end up with what we call tunnel vision. This is one of the reasons why, in most cases, you don't realize that you're losing your vision, because you can have severely advanced glaucoma, but you are seeing well straight ahead, but you are not seeing all around. So you haven't noticed that you're not seeing, but it's very unsafe to actually be driving on the roads and functioning with that tunnel vision. So that picture actually shows that's how people with advanced glaucoma may see, and it gets smaller and smaller as it advances. How can people with glaucoma protect their vision, or people who are at risk of glaucoma? Before the age of 40, every 2 to 4 years, you should get checked. And as simple as your optometrist could check it. It doesn't always have to be a doctor. From age 40 to 54, every 1 to 3 years, 55 to 64, every 1 to 2 years, and after 65, every 12 months. And people with glaucoma, we put them on drops to slow the progression of the damage to the nerve. Now, just a note on that, people ask if we can do surgery on the eyes. Yes, there are surgeries that you can do for glaucoma, or laser treatments that you can do for glaucoma, but typically, we always try to start with conservative treatment, which is medical treatment. And the medical treatment, once it's working, we don't necessarily have to step up to lasers. But all those things we take into consideration, people's age as well. So how people with glaucoma can protect their vision: use medication appropriately, regular exercise, controlling the diabetes and hypertension, and wearing protective eyewear, because another risk of glaucoma is trauma to the eyes. Age-related macular degeneration is another topic. It's a degenerative disorder affecting the macula, characterized by specific clinical findings, including drusen and retinal pigment epithelial changes. The later stages of the disease are associated with visual impairment. This tends to happen in lighter eyes, so it doesn't happen as regularly in Trinidad. But ways to prevent this, I should mention the risk factors first, which is the family history of it, advancing age, as it's age-related macular degeneration, lighter eye color, obesity, high blood pressure, smoking, sun exposure, and nutrient deficiency. So what you would use in this case is vitamins for the eyes. You'll find them on the shelves over the counter. They'll have a high consistency of vitamin A. Good for the eyes is also vitamin C and E. Lutein in particular for age-related macular degeneration, and zinc and essential fatty acids. I'll talk about this just now a little more. So I just have some tips for the eye. So those are the topics that people will hear most commonly associated with their eyes that you may have questions about. And so in addition to that, I'll just move on to some little tips in terms of keeping the eyes healthy. So first of all, you'll eat well. Oh, I don't have that on the slides anymore. You'll eat well. Good eye health starts with food on the plate, just like that picture before. Nutrients like omega-3 fatty acids are important for dry eyes. Lutein and zinc for age-related macular degeneration. A, C, and E might also help ward off age-related problems. Green leafy vegetables like spinach, kale, collards, salmon, tuna, and other oily fish, eggs, nuts, and other non-meat proteins as well, oranges and citrus fruits or juices, liver, oysters, and pork. Our well-balanced diet also helps to keep you stay at a healthy weight, and that lowers your odds of obesity and age-related diabetes like type 2 diabetes. Most importantly, quit smoking or never start, a pet peeve of mine. Research has linked smoking to an increased risk of cataracts, damage to your optic nerve, and macular degeneration, all of which can lead to blindness. If you've tried to kick the habit before only to start again, keep at it. The more times you try to quit, the more likely your chance to succeed. You can also ask doctors for help. There are ways to stop smoking. Smoking is as bad for you as your eyes, as it is for the entire rest of your body. It's one of the worst things you can do. Maintain your blood sugar levels. 90% of blindness caused by diabetes is preventable. Ask your healthcare team to help you set and reach goals to manage your blood sugar, blood pressure, and cholesterol, also known as the ABCs of diabetes. Be cool and wear your shades. Sunglasses are a great fashion accessory, but their most important job is to protect your eyes from the UV rays. The right pair of sunglasses will help you protect your eyes from the UV rays. Too much UV sun exposure boosts your chance of cataracts and macular degeneration. We spoke about most of these things, but I just ensuring these little tips. Choose a pair that blocks about 99% to 100% of ultraviolet A and UVB rays. Wrap-around lenses actually help protect you better because the more glare you take out, the better for your eyes. Polarized lenses also reduce glare while you drive, but don't necessarily offer added protection. If you wear contact lenses, some offer UV protection. It's still a good idea to wear sunglasses for an extra layer. Use safety eyewear. If you use hazardous or airborne materials on the job or at home even, wear safety glasses or protective goggles. Sports like squash, cricket, football can also lead to eye injury. Wear eye protection. Helmets with protective face masks or sports goggles with polycarbonate lenses will also shield your eyes. Doing activities at home like power washing and lawn mowing have brought in such dramatic eye changes for patients in our place that I have protective eyewear for my 2-year-old and 5-year-old at home, because people can lose their eye with power washing and lawn mowing, from a stone flying to the power wash water somehow fly in your eye. It's terrible. Please wear protective eyewear. Also, as simple as if you're grinding metal, if that's your job or if that's what you just decided to do at home, protective eyewear. Employers are required to provide a safe work environment. When protective eyewear is required as part of your job, make it your habit to wear appropriate lenses at all times and encourage your coworkers to do the same. Look away from the computer screen, as I mentioned before. Give your eyes a rest. Staring at a computer or phone screen for too long can cause all the things we talked about before. So, to protect your eyes, make sure your glasses or contacts prescription is up to date and good for looking at a computer screen. If your eye strain won't go away, talk to your doctor about computer glasses. Move the screen so your eyes are level with the top of the computer that lets you look down slightly at the screen. Try to avoid glare from windows and lights and use an anti-glare screen if needed. Choose a comfortable and supportive chair and position yourself so that your feet are flat on the floor and your neck is only slightly downwards. If your eyes are dry, blink more consciously or try using artificial tears. Rest your eyes every 20 minutes. Look 20 feet ahead for 20 seconds and get up at least every 2 hours and take a 15-minute break. I just told you all that more because I know there are a lot of kids and adults who are at a screen on a daily basis, whether it's your phone or computer. Visit your eye doctor regularly. Everyone needs a regular eye exam, even young children. It helps protect your sight and lets you see your best. You might think your vision is fine, that your eyes are healthy, but visiting your eye professional to examine the back of your eye is the only way that you can be really sure with special equipment to know whether or not you may have glaucoma or diabetic changes, or even some kids have some other things going on. Some people don't realize that they can see better. Some people don't even know that they can see better with glasses or contact lens. They may have not been seeing for many, many years, but they just thought that that's the way to see the world. And only when they actually come in for an eye exam or something went in their eye and they decide to cover one and they say, oh, doc, I'm really not seeing good with the eye, you know. But they were probably seeing like that all the time. They just didn't know. Eye exams can discover diseases like glaucoma and diabetic eye disease. It's important to spot them earlier on because then they're easier to treat. Know your family's eye health history. Talk to your family members about their eye health history. It's important to know if any one of them probably had hereditary diseases like retinal pigmentosa, less common in our people. but glaucoma is very common and runs in a lot of families, so you should know whether your family members have it or not. Anything hereditary in terms of eyes, you should know if anyone else has it. For people who wear contact lenses, wash your hands properly, clean them properly, put them away at night, do not sleep with them. Please do not use plant substances in your eyes. And just for anybody who knows people who are blind, there is a very active blind welfare society. I know in San Fernando it's on Coffee Street. They are very good. They have cricket team, cricket matches. They weave baskets. It's really, really good, and they are very helpful, and they are able to help people learn how to manage becoming blind or blind. And there are locations that do diabetic eye screening, some private, some public, but as mentioned before, if you are diabetic, you do it you should at least have a retinal exam once a year. There's also UE optometry school, which helps children a lot in terms of getting their glasses, or if they need any children with squints, they help them get the proper corrective lenses they need. If you all have any questions. Sure.
Right, so thank you, Dr. Tiwari. So I think this is a question time. We'll facilitate a couple questions. I think Uncle Ajora has one, so we will, unfortunately, we don't have a mic to circulate.
It is. People are having much more allergic conjunctivitis reactions to the Sahara, so it's itchy, watery. You can use, there are drops you can use for it, and you can also use like oral antihistamines to help as well. And with the Sahara as well, what would also help is that lid hygiene that I was talking about, with the warm compressors and baby shampoo and water to just clean off the dirt and debris that would be extra dirt and debris that probably collecting. Definitely, there has been an increase with dry eye problems, and the younger kids with the myopia and needing glasses at an earlier stage. So it did create quite a problem, but I mean, that was there before, but I think COVID just upped the game a bit. So that's why we are so for us, screen time is a big thing where you try to keep them off the screen as much as possible. Go outside, play, exercise those eyes. The eyes have muscles that need to be used as well, not just focused in one spot for the entire day. So, and it also, as I said, using screens tend to reduce your blink rate. So the tear film is not renewing itself as it should. So it leads to the dry eye problem as well. So ocular lubricants help. Is that good?
Thank you. Any other questions? I know some persons tend to want to ask their questions privately, so I'm sure Dr. Tiwari might facilitate you after service, unless there are any other questions. No? Okay, so thank you so much, Dr. Tiwari.
Thank you very much. I hope I gave you all some insights into your site.
Thank you so much. And again, this is a continuation in our health series. And one of the things that was taken away from that is the reinforcement about lifestyle, our diet, exercise, and critically not smoking. And I will add to that, smoking includes vaping. So please ensure that, and Doctor is nodding her head as well. Young people tend to think, well, vaping is okay. It's not okay. So please be mindful of those things. I think it's very, very important, and I'm glad. Once more, please express our gratitude to Dr. Tiwari for her wonderful presentation this morning. I'll invite us all to now come forward to engage in our arti and our offerings as we hand over to the group. And as they engage in kirtan, let us also join together, sing and glorify Bhagwan.
Hari Om Tat Sat, Hari Om Tat Sat, Hari Om Tat Sat, Hari Om. Hari Om Tat Sat, Hari Om Tat Sat, Hari Om Tat Sat, Hari Om. Hari Om Tat Sat, Hari Om Tat Sat, Hari Om Tat Sat, Hari Om. Hari Om Tat Sat, Hari Om Tat Sat, Hari Om Tat Sat, Hari Om. Krishna Krishna, Krishna Krishna, Jai Radha Krishna. भक्तों गाओ मंगल गीत, मेरे घर गूंजा संगीत। भक्तों गाओ मंगल गीत, मेरे घर गूंजा संगीत। मिलकर गाओ मंगल गीत, मेरे घर गूंजा संगीत। मिलकर गाओ मंगल गीत, मेरे घर गूंजा संगीत। रिद्धि सिद्धि संग सिद्ध करता आई है, शुभ लाभ संग विघ्न हरता आई है। आज मेरे घर मंगल करता आई है, गणपति बाप्पा मंगल करता आई है। जब मेरे बाप्पा के कदम पर गणपति बापा घर दिए मेरे दामन। जब मेरे पप्पा के कदम पड़े तो महका घर और आंगन। बिन मांगे मेरे गणपति बापा भर दिए मेरे दामन। बुद्धि विनायक पालन करता आए हैं। सिद्धि विनायक पालन करता आए हैं। आज मेरे घर मंगल करता आए हैं। गणपति बापा मंगल करता आए हैं। गणपति जपते जपते जीवन को मैं दगर मिली। अपनों में मैं ठुकराया तो घेरों में भी कदर मिली। हम गणपति जपते जपते जीवन को दे दगर मिली। अपनों में ठुकराया तो घेरों के भी कदर मिली। दीन प्रभु प्रभु दुख हरता आए हैं। दीन प्रभु मालिक दुख हरता आए हैं। आज मेरे घर मंगल करता आए हैं। गणपति बापा मंगल करता आए हैं। आइए गणपति जगवंदन शंकर सुवन भवानी के नंदन। सिद्धि सदन गज वदन विनायक कृपा सिंधु सुंदर सबलायक। आइए गणपति जगवंदन शंकर सुवन भवानी के नंदन। सिद्धि सदन गज वदन विनायक कृपा सिंधु सुंदर सबलायक। भरण पोषण करते जग करता आए हैं। भरण पोषण करते जग भरता आए हैं। आज मेरे घर मंगल करता आए हैं। गणपति बापा मंगल करता आए हैं। मोदक प्रिय मुद मंगल दाता विद्यावारिधि बुद्धि विधाता। भगत तुलसीदास कर जोड़े बस ही राम सिया मानस मोरे। मोदक प्रिय मुद मंगल दाता विद्यावारिधि बुद्धि विधाता। भगत तुलसीदास कर जोड़े बस ही राम सिया मानस मोरे। भजनों में दिव्य के सुख करता आए हैं। कैलाश दिव्य घर जग करता आए हैं। आज मेरे घर मंगल करता आए हैं। गणपति बापा 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 मंगल करता आए हैं।
गोविंद हरे गोपाल हरे हे गोपी गोप बाला। गोविंद हरे गोपाल हरे हे मुरली गान लोला।
गोविंद हरे गोपाल हरे हे गोपी गोप बाला। गोविंद हरे गोपाल हरे हे मुरली गान लोला।
गोविंद हरे गोपाल हरे हे गोपी गोप बाला। गोविंद
गोपबाला गोविंद हरे गोपाल हरे हे मुरली ज्ञान लोला
हे गिरिधर गोपाला हे गिरिधर गोपाला हे गिरिधर गोपाला
हे गिरिधर गोपाला हे गिरिधर गोपाला हे गिरिधर गोपाला
जय जय गिरिधर गोपाला जय जय गिरिधर गोपाला जय गिरिधर गोपाला
जय गिरिधर गोपाला जय गिरिधर गोपाला जय गिरिधर गोपाला
गोविंद हरे गोपाल हरे हे गोपी गोपबाला गोविंद हरे गोपाल हरे हे मुरली गान लोला
गोविंद हरे गोपाल हरे हे गोपी गोपबाला गोविंद हरे गोपाल हरे हे मुरली गान लोला
गोविंद हरे गोपाल हरे हे गोपी गोपबाला गोविंद हरे गोपाल हरे हे मुरली गान लोला
गोविंद हरे गोपाल हरे हे गोपी गोपबाला गोविंद हरे गोपाल हरे हे मुरली गान लोला
हे गिरिधर गोपाला हे गिरिधर गोपाला हे गिरिधर गोपाला
हे गिरिधर गोपाला हे गिरिधर गोपाला हे गिरिधर गोपाला
जय जय गिरिधर गोपाला जय गिरिधर गोपाला जय गिरिधर गोपाला
जय गिरिधर गोपाला जय गिरिधर गोपाला जय गिरिधर गोपाला
ओ चित्त चोरा यशोदा की बात नवनीत चोर गोपाल
चित चोरा यशोदा के बाद नवनीत चोर गोपाल
ओ चित्त चोरा यशोदा की बात नवनीत चोर गोपाल
चित चोरा यशोदा के बाद नवनीत चोर गोपाल
गोपाल गोपाल
गोपाल गोपाल
गोपाल गोपाल
गोपाल गोपाल
गोपाल गोवर्धन धन गोपाल
गोपाल गोवर्धन धन गोपाल
गोपाल गोपाल
गोपाल गोपाल
गोपाल गोपाल
गोपाल
गोपाल गोवर्धन धन गोपाल
गोपाल गोवर्धन धन गोपाल
हे गिरिधर गोपाला हे गिरिधर गोपाला हे गिरिधर गोपाला
हे गिरिधर गोपाला हे गिरिधर गोपाला हे गिरिधर गोपाला
जय जय गिरिधर गोपाला जय गिरिधर गोपाला जय गिरिधर गोपाला
जय गिरिधर
चोरा यशोदा की बात, नवनीत चोर गोपाल। चित चोरा यशोदा की बात, नवनीत चोर गोपाल। ओ चित चोरा यशोदा की बात, नवनीत चोर गोपाल। चित चोरा यशोदा की बात,
नवनीत चोर गोपाल।
नवनीत चोर गोपाल, नवनीत चोर गोपाल।
We'll now have our announcements.
Sitaram. So first of all, welcome to our Sunday morning service. Glad to see so many of you guys here this morning. Special welcome to any new members that we have here, and to anyone who has been here after some period of absence. Special happy birthday or happy anniversary to everyone celebrating their birthdays this week gone or this week upcoming. Happy birthday to Auntie Rama, who celebrated her birthday yesterday, and to Asha, who's celebrating her birthday tomorrow. Anyone else celebrating their birthdays? No? Okay. So anyone who wishes to make donations, whether in cash or kind, to the temple can see Uncle Gangadin or Auntie Nila in the office after service to make those donations. Anyone wishing to perform puja on a Sunday morning can also see Auntie Nila or Uncle Gangadin in the office after service. Tomorrow afternoon at 5:30, we will have yoga class right here in the annex, upstairs the annex. So for those of you who are interested in joining in the yoga class, or for those of you who are already part of the yoga class, there will be class tomorrow at 5:30 p.m. Special thanks to Dr. Tiwari, who excellently went through that presentation on eye conditions. Let's have another round of applause for her. It was expertly done. So that the initiative to do those medical talks at the temple is one the management wants to continue and wants to do at least once a month, so that we touch on health-related issues that affects all of us right here at the temple and this congregation. Awareness is the best medication, right? We will be having Ramlila celebrations on the 11th, 12th, and 13th of October. So it will be held on the Robbins Recreation Park, right on Knox Street. So this is the first year we'll be back with the Ramlila since COVID, since pre-COVID, 2018 or 2019 was the last year that we had Ramlila celebrations. So we're looking forward to it. For those of you who still want to take part, the kids that still want to take part, please see me after service, myself or Amral Dariel after service, and we still do have space for kids to take part as well. Next week, Sunday, we'll be doing the Tarpan offering, as Panji went through this morning. So we want to start for 8 a.m. So those of you who wish to do that offering, please reach before 8 a.m. so that we can start at 8 a.m. right here at the temple. Special thanks to everyone who came out for the Ganesh Utsav celebrations and who made it possible. Special thanks to Panditji, to Anil, to everyone who came out night after night to make that 5-night yajna the success that it was. Navratri again will be celebrated. A lot of announcements. Navratri again will be celebrated the 3rd to the 11th of October. Right, so we will have evening worships here at 6 p.m. every evening from the 3rd to the 11th of October. So please do come here. We start at 6 to 7:30 on evenings, right? So it'll be right here at the temple. The Balvihara class started the new term today. Glad to see so many of the kids here. I'm glad to see the attendance was good today. The teacher just let me know that she wants to see the parents of the kids right after service, right in the front here. Yeah, right in the front here. So the parents after the service, parents of those kids, please come out right here after service just to meet with the teachers. if you do have friends, family, relatives who has little kids below the age of 11, below secondary school, please encourage them to come out. The Balvihara class is an excellent class where they will learn about our religion as well as secular parts of the religion as well. The Diwali program is carded for the 27th of October, right? So that's just to note the date, but the more details will come after. No, this is the Diwali dinner. This is the Sri Sevak Sabha will be having their Diwali dinner on the 19th of October. Yeah, so it will be 5 p.m. right here at the annex. So for those of you who want to get tickets, any member of the Sri Sevak Sabha, you can see them after service or in the coming weeks, and they will have tickets available. So everyone enjoy the rest of your week. Sitaram.
Sitaram, thank you, Mitra. We now stand for final arti and closing prayer.
वसुदेवसुतं देवं कंसचाणूरमर्दनं देवकी परमानन्दं कृष्णं वन्दे जगद्गुरुम् आरती कुञ्ज बिहारी श्रीधर कृष्ण मुरारी की आरती कुंज बिहारी की श्रीधर कृष्ण मुरारी की आरती कुंज बिहारी की श्रीधर कृष्ण मुरारी की श्री आनंद चंद मोहन ब्रज चंद राधिका रमण विहारी की श्री गिरिधर कृष्ण मुरारी की आरती कुंज विहारी की श्री गिरिधर कृष्ण मुरारी की गगन सम अंग कांति काली काली राधिका चमक रही आली आली रतन में हार कनमाली कनमाली भ्रमर से अलग कस्तूरी तिलक चंद्र से झलक ललित छवि श्यामा प्यारी की श्री गिरिधर कृष्ण मुरारी की आरती कुंज विहारी की श्री गिरिधर कृष्ण मुरारी की शिव शीश जटा के बीच अड़े अग कीच चरण छवि श्री बनवारी की श्री गिरिधर कृष्ण मुरारी की आरती कुंज विहारी की श्री गिरिधर कृष्ण मुरारी की चमकती पूजन लत रेणु रेणु बजा रही वृंदावन वेणु वेणु चहुदिसी गोपी ग्वाल दीनु दीनु असक भव मन चांदनी चन कतक भव पन देर सुनो दीन बिहारी की श्री गिरिधर कृष्ण मुरारी की आरती कुंज विहारी की श्री गिरिधर कृष्ण मुरारी की आरती कुंज विहारी की श्री गिरिधर कृष्ण मुरारी की श्री गिरिधर कृष्ण मुरारी की श्री गिरिधर कृष्ण मुरारी की
Hari Om. As we conclude our puja and our satsang this morning, we immerse ourselves in the presence of Bhagwan, seeking his continued guidance and inspiration. As we commence this new week, we ask for that protection as we go through our daily activities, that we would indeed have that blessing of Bhagwan with us all. We pray for our families, we pray for our loved ones. We pray for those persons who may be ill and at home, those persons who may be ill in the hospitals or the nursing homes. We pray in a special way for persons who may have lost their loved ones. And this morning, during this most auspicious time, we direct our minds to our foreparents or ancestors who are no longer here with us. Bhagwan, we know that you hear our prayer. We know that your mercy is great, that you are omniscient and omnipotent. And as we surrender ourselves to you in this closing pratna, we ask you to continue to shower your blessings upon us all. Hari Om. Tvameva Mata Cha Pita Tvameva Tvameva Bandhu Cha Sekha Tvameva Tvameva Vidya Dravinam Tvameva Tvameva Sarvam Mama Deva Deva Om Sato Ma Satgamaya Tamaso Ma Jyotirgamaya Mrityorma Amritam Gamaya Om Shanti 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 Hari Om. प्रेम से बोले श्री गणेश भगवान की जय, उमापति महादेव की जय, वृंदावन बिहारी लाल की जय, आज शक्ति जगदम्बा देवी मैया की जय, श्री पवन पुत्र हनुमान की जय, प्रेम से बोले श्री सच्चे सनातन धर्म की जय. To those around you, sab koi jai jai Sitaram. A very powerful week ahead, and as we listen to the birthday song for our celebrants, I want to remind all of the parents, please come forward. The parents of the Balvihar kids, please come to the front. We also are asking for some able-bodied young folks. We need a hand to move the Singhasan back to the back, and the table that we use for Ganeshji to take him downstairs. So if we can have the assistance of a couple able-bodied persons at this time, we would be grateful. Jai Sitaram, everyone. We look forward to seeing you all with us. Next week, Sunday, Tarpan offering starts at 8 a.m. So please come ahead of that time.